Welcome to the podcast, Hopeful Horizons, the bridge where hope and healing meet. Our mission is to create the environment and resources to get people across the bridge from the post-COVID experience to a future filled with hope. Please welcome our host, Holly Porter, founder of Adventure Bucket Wish Foundation.
Hi, everyone. Welcome to the podcast today. We're going to be diving in with a medical professional, and I'm really excited to have him because he's going to be talking about some new things that have come up for my long COVID healing and journey. And I can't wait to have you get the help that he's given me. So his name's AJ Rimmasch, and he has Copper Rock Clinic in St. George. So welcome. A couple more things about him real quick. So he's a nurse practitioner now for over 10 years, and he's been in the health sector for 7 or so, specializing in hormones and peptides. He's competed in several Ironman triathlons, and he lives in St. George, where we have the Ironman, right? And he's married with 6 children. So he's busy, and you can see he's in his scrubs. We grabbed him on his lunch hour. So we're really grateful that he showed up to help us and answer some of these questions today. So thank you. Welcome to the show.
Yeah, thank you. I'm glad to be here. And anything we can do to help spread awareness of long COVID and the things that are available to help people out. It's great.
Oh, love that. Well, we're going to dive in. I did explain to AJ that a lot of people with long COVID really struggle with the medical because they get ignored, they're gaslit, and it's frustrating. And so I'm glad that he is willing to listen. I've been through lots, and it's not because I didn't like them. It's just they just didn't know how to help me. And so he's probably helped me more than anyone. So listen till the end so that you can grab a couple nuggets there and how he could help you as well. Let's just dive into a couple questions. We're going to talk about peptides for a few minutes and how they work with the body system. So can you explain, first of all, what they are, how they might be beneficial in addressing long COVID symptoms?
Yeah, well, peptides are just short chain amino acids, 1, 2, 3, 4 chains of specific aminos. A protein is a complete chain of an amino, and these peptides are short chains. Peptides that people are probably familiar with are like insulin. Insulin's a peptide. So for people that have diabetes and they use that to help control their blood sugar, they're on peptides. And there's several other peptides. Growth hormone's a peptide. And that's one that people may know of as well. And some new and up and coming peptides. And these peptides have shown great potential to help promote healing and reduce chronic inflammation and swelling, joint pains, even enhance energy and improve sleep. So peptides are an up-and-coming treatment modality that I think is going to sweep the healthcare industry over the next few years.
How come we're just now, it's like now that's the big buzzword, but why are we just now hearing more about them?
Yeah, I think it's becoming popular because of social media. Peptides have been around for a long time. We've been using growth hormone, pre-to-GOG peptides for decades for treatments for people that have growth deficiencies, people that have muscle wasting conditions. And some of these peptides are newer. So like BPC-157, that's a peptide that your body produces, but that's a newer peptide on the market and currently being actively researched for multiple causes and purposes for helping people feel better.
Yeah, let's talk a little bit more about that one, because I think people that have long COVID, I mean, we know a lot of diseases, inflammation, and long COVID has a lot of that included in it. Tell us more about that.
Yeah, BPC-157, the complete name is pentadecapeptide body protective compound 157. So a very huge name, right? I mean, just way too much to say every single time. So BPC-157 for short. This is a peptide that your body naturally produces in the gut, right around the stomach and the duodenal junction. And it helps to repair stomach lining, the intestinal lining, and in some cases, it actually will send this BPC-157 throughout the entire body. We don't really understand how it gets out of the gut and into the bloodstream to where it needs to go, but it does. And it's amazing. It has great healing qualities to it. And we've seen fantastic results with people. including long COVID patients that are suffering from chronic joint pains and just general aches and pains as well. And just seems to be a wonderful product. Now, this peptide is really interesting in the fact that nobody else or no other animal makes BPC 157 other than humans. And so this is one that is bioidentical, but it is actually synthetically produced in a lab. But it is bioidentical to the peptides that our body produces. A lot of the other peptides are natural bioidentical peptides to what our body already produces. So that's one caveat with this one, is it is not a naturally occurring peptide. It is synthetically produced.
And the side effects are low,
side effects,
right?
yeah, this is really interesting. We don't have a lot of known side effects with this yet. It's been in the research category for probably 12 to 15 years and has been moderately used through that entire time frame. And over the last 2 or 3 years has really picked up steam in usage through various compounding pharmacies. Yeah. And that's where we're getting a lot of the data is widespread use. Hundreds of thousands of people using this is helping us to understand all of it. So we don't really know the risks on BPC 157. We haven't seen a lot of risks in our clientele and our patients that are using it. I have a lot of physician friends that are using this treatment as well in their clinics. They're not seeing a lot of side effects. Understanding the process of BPC 157 can help. And sometimes we can look at the process and say, well, this is maybe a potential risk. BPC 157, as it enters an area of trauma or inflammation, actually promotes growth of blood vessels to that area to help bring in growth factors and other peptides to help recover the injury. And so some people speculate that maybe the increase in blood vessel growth could potentially, what's a good word to use? It could potentially help tumors grow as well. Now, we haven't seen that, but that is a potential, it's a theory, and research is continuing. And again, we have not seen anything in that come forward yet. But that's one of the risks that is commonly brought up, is it creates this new blood vessel growth and might promote tumor growth. But again, we have yet to really see it. It's just a theory.
Yeah, suffering. They're about willing to try anything. I'm just wondering, like, what would be the considerations they should be looking at or asking their doctor about it?
Yeah, I agree. Definitely you want to be able to understand what you're taking. And there's so many things out there on the internet about what's good and what's bad. Getting with the right provider that understands peptides is going to be the first and foremost thing you need to do. The traditional medicine community isn't very familiar with peptide therapies other than insulin or even some of the peptides for weight loss, right? They understand those a little bit and are totally fine there. But these up and coming peptides that are still in the more of the research side, they don't understand at all. And you would say, hey, doc, I want to try BPC 157. And they'll say, what's that? Is that a supplement? Right. And they'll have no idea. And they'll Google it, right? Just like anybody would say, BPC 157, what's that? And then they'll say, ooh, I don't know, because they don't understand it. For sure.
Right. And you can do it. It's a compound. So compound pharmacy has to do it, but you can do it in a shot form or a capsule, right? Both ways.
Yeah, there's oral versions and injectable versions. There's not a lot of difference from what I've found with my patients and with kind of the anecdotal evidence online with other people that have been using these treatments for a while now, is they can inject it in a localized area. Say you're injured your knee, inject it there, or take it orally, and it's 45 to 60 days and they see results either way. And so they both work pretty well. You said compounding pharmacy. I want to bring that up. I mean, it's very, very important that you're getting these treatments from from legitimate compounding pharmacies that are certified, because there is a lot of garbage online that you could purchase easily, that you may or may not be getting BPC
Don't buy
157
it on
from these
Amazon.
online stores. No, especially the injectables. The injectables, if they're not coming from a legitimate pharmacy, they're usually laden with lipopolysaccharides, which are pro-inflammatory in your body. And you're taking an anti-inflammatory product. Why would you want to take one that's going to inject more
Yeah, cancels it out.
inflammation into your body? Yeah, and it's purely a filtration process while compounding, and that's why we want to use legitimate pharmacies when
Yeah, really good points.
when getting these. Yeah.
So for long-term use of peptides, and I know we've just talked about the one, we'll go into the other side of it. But long-term, short-term, what would you say is safe?
Most of these are pretty safe to use long term. Again, we don't have a lot of decades long usage research on this yet, but what we've seen anecdotally, that's just people taking it, is there is no change in your blood biomarkers that would suggest that it's damaging as far as your kidneys and liver function. I generally recommend with BPC 157 a 60 to 90 day course and then some time off. And then you can resume it again after 1 or 2 months of break.
And you can see if it's really working, right?
Oh, for sure. Oh, yeah.
At that point, if you're not sure.
Some of these other peptides people have been using for decades without repercussion. So some of them,
well, especially diabetic, right? If you have diabetes.
Insulin. Some of the weight loss peptides like the semaglutide and the tirzepatides, those treatments have been used for a long time in diabetics, and we don't have any repercussions as far as those go. Yeah.
So let's jump into talking about the weight loss ones that are peptides and kind of segue into the whole hormonal for people. Like we have men and women that are listening, and so they're all messed up from long COVID in all different ways.
Yeah,
no two people are alike, for sure. Anyway, can you go into that a little bit more?
Yeah. So semaglutide, or brand name is Ozempic, and Wegovy for weight loss, and tirzepatide brand names are Mounjaro and Zepbound, and those are all peptides as well, and they're very, very effective. They are once weekly injections, and prior to once weekly injections, they were daily injections, and they weren't very successful because people didn't want to do a daily injection for weight loss. Just having to do that shot every single day, we had a hard time with compliance. But with these weeklies, it's been pretty successful overall for weight loss. When it comes to COVID, post-COVID, long COVID conditions, weight loss can be very, very beneficial. We see people regain energy that they had before COVID just by dropping 10, 20, or 30 pounds, and just improves all conditions whenever we can get rid of some excess fat. Fat harbors inflammation naturally. And so anytime we can clear a little bit more fat off of our bodies, you're going to feel better. And so those peptides can be very helpful for that.
And you also do hormone therapies. How would you, do they work together? Can you work them together?
They do. All of this works together, actually. I'm thinking of COVID too, with hormone imbalances, and the latest studies are showing that long COVID is associated with hormone imbalance, be it thyroid, estrogen, and testosterone in women, especially in perimenopause and menopause. Perimenopause is that 10 years leading up to menopause. And we see very low estrogen lows and very, very low testosterones in these perimenopausal women. And that makes it hard to do anything. And so what we're finding is if we can just support these levels up a little bit higher, people are seeing moderate resolution of their long COVID symptoms by just bringing in a little bit of testosterone, a little bit of estrogen, and a little bit of progesterone. And we see improved focus and concentration. The brain fog seems to dissipate quite a bit. Sleep improves, recovery, aches and pains seem to get a little bit better. It's not a magic bullet by any means, but I think it's a piece of the puzzle as we move forward and as we learn more and more about long COVID. I think fixing kind of that foundational base of hormone health that COVID seems to be disrupting quite a bit can help resolve a lot of symptoms. And, jumping in through that, like I've seen hormone imbalances in younger and younger people, women and men in their 20s that have had a moderate case of COVID. They may not have long COVID by any means, but they come in, they say, man, I'm so much more tired than I remember being just a year or two ago. And yeah, sure enough, they've had COVID and they're not feeling great. We check the hormones, and these younger women have these estrogen imbalances that are through too much estrogen, not enough progesterone, and their testosterones again are kind of in the toilet. They're so low for such a young person, and we've seen great results in these younger people post COVID as well, just to help bring back that energy that they're missing. And same with the men. We're finding these young men in their 20s and early 30s, and testosterone's 200, and at their age they should be 700, 800, and they're so low, and they just feel like garbage. And sure enough, they're all post COVID, and we don't have like good correlation data to show that it was COVID by any means, but it sure does seem to be more common now than it was.
I think it is a version of long COVID, because we had a guest on here that had no symptoms. He tested positive. His wife was in the hospital actually 4 months, longer than me, and had a baby while she was in there. It was crazy. Wow. But he had no symptoms, but tested positive, so they wouldn't, let him in there or anything. But he never felt like he ever got anything. And he has long COVID now. Well, there's no rhyme or reason. If they got COVID, period, I think you can have long COVID. You just might. It's like every mental illness, every illness has its level, right? So
for sure.
They're a lower version or a higher version of it. And I think long COVID's the same way. Everybody, with 200 symptoms identified, I don't think there's just a lot of variables there going on. But can you fix tinnitus? That's what I want to know.
Can we? Ooh, that's a tough one. But there's things we can do for it. A lot of it varies in treatment styles and modalities. But there are so many symptoms though with long COVID. And we keep learning more and more. Every day it seems like something else comes out and they say, well, this is associated with long COVID as well. Like we're even seeing like we're seeing moderate to severe depression and anxiety that people had maybe when they were 20, all of a sudden is resurfacing again. After a solid COVID case. Again, I go back to hormones with these symptoms as well, with the anxiety and depression. Like we treat these men and women with these COVID symptoms with the hormones, and they do see pretty solid improvements in the way they feel, their disposition, and how they carry themselves, how they approach life, as we fix some of these numbers for them. And it just really does ease up some of their COVID symptoms. Again, we're not going to be able to completely wipe them all out. I don't think we will. But, our hope is that we can at least make it more manageable and more tolerable as well. And hopefully over time, overcome a lot of these complications. Yeah.
Right. Well, I just appreciate you looking into things and being willing to do the research to find more information out there, because it's just the song we hear all the time and nobody really knows. I feel like we, as the people with long COVID, are teaching the medical industry by watching, and the ones that are willing to listen and learn, it's super helpful, because they're so backed up. The clinics that specialize in long COVID, it is frustrating. So I've noticed the symptoms you might have had before when you talked about like anxiety and depression. I didn't have that before. That all got created. But my case was super extreme. And I don't want people to think you had to be so extreme to have long COVID, because you didn't. You could have got it like a cold, and now you have all these health issues. I just think things lay dormant in our bodies that may never manifest, and COVID woke them up and caught everything on fire.
Sure. Like I was just reading a study earlier today about long COVID and some of the other issues we see with it. It can actually resurface Epstein-Barr virus, mono, and then you have compounding problems. You're dealing with the mono side and you're dealing with the long COVID side. The other one that has been occurring is low growth hormone release at night. That low growth hormone release kind of destroys your deep restorative sleep. If you don't have enough growth hormone at night, you're not going to get better. There's peptides that help with growth hormone that aren't necessarily synthetic growth hormone, but they actually support your body's production and release of its own growth hormones. So there's peptides that do that as well, and help improve that. It's pretty neat. So some of those peptides are like CJC 1295 or ipamorelin or tesamorelin or tesamorelin, depends on who you talk to. Samorelin, those are all like the growth hormone secretagogue peptides. And those can help with long COVID symptoms as well, as we kind of boost those growth hormone, the growth hormone production overnight while you're sleeping. And then you get better sleep, you get restorative sleep, and you recover. And so there's so many things we're learning and so many treatments that are available. Not all of these are FDA approved per se for these treatments. And that's one thing to understand is these are somewhat experimental, but they have a lot of research back behind them over the last 10, 15, 20 years that just hasn't been reviewed by the FDA to get clear.
Which doesn't say much to me.
And sometimes it's that big pharma piece, right? Like pharma's like, well, I can't make money on tesamorelin as a growth hormone secretagogue to help improve sleep and recovery, and so we're not going to market it that way, and we're not going to sell it as a prescription. And so then the FDA never has to approve it. That doesn't mean it's not a good treatment. It's just that it wasn't ever picked up by a big manufacturing company like I can't even think of all the ones right now. There's so many of them, right? But then the FDA doesn't have to do anything because nobody picked it up to sell it. Right. And so these treatments can be very, very beneficial, but sometimes you have to understand that it's much more on the alternative side of health than it is on the mainstream side of health.
Right. I appreciate that you're always willing to think outside the box. A friend of mine brought me to you, and I was grateful. She explained a lot of things to me. It was so confusing, and with my brain fog, everything was like, what are we even talking about? I don't know what these even mean and what they are. And so I think if you're thinking about maybe looking into some of these peptides he's talking about, do your research first, but you're going to find I think you're going to find a lot of good ad and things, but you're willing to do telehealth. Let's talk about that for a minute, because you can talk to anybody anywhere, right?
Yeah, we can do a consultation across the country, and we can discuss potential treatment options for long COVID in the peptide realm and even the hormone realm. And I can help point you in the right direction and kind of coach you along that process to help you find resources in your area and get you set up that way. Because it is hard. Sometimes you just don't know where to go. And I want to be available for people to come to me and ask me these hard questions and help them to kind of get the ball rolling for them and get them where they need to be to get better and help them improve. So we can definitely do a virtual telemed consultation available through my website, and it makes it really easy. And we have pretty good availability most of the time. We're not too many days out in general. We can usually get people in within the week, sometimes sooner, because we don't focus on seeing 100 patients a day. We really try and focus on the few that we see to make sure that they're getting the care they need and that they're being listened to, especially. So that's the biggest piece.
Everyone here with long COVID, give them a shout out for that. That matters. It really does.
I agree. Yeah. I've dealt with some of that long COVID myself. I had it a couple of years ago, and I spent months and months and months trying to feel myself again. Even though I was doing the exercise and the Ironman races, they were getting harder and harder, and it was harder to recover and everything. And that's when I started really diving into the long COVID myself. Was right when I had it and experienced it, and I learned a whole lot from some great mentors. And that's where I am, helping other people now.
I love that. And I thank you, and I'm sure a lot of other people will as well. Can you say your website and maybe your phone number? And then if you can't jot it down and you're listening, we'll put it in the show notes so you can get a hold of him.
Super easy. It's copperrockclinic.com. So www.copperrockclinic.com. And if you want to reach out via phone, you can call 435-900-1210 and talk to my receptionist, Amber, and she can get you set up for a consultation for just peptides or whatever you want to talk about. If it's COVID, some of the potential things we can do to help you feel better and get you pointed in the right direction, we can definitely do that as well.
Great stuff. If you're listening, I hope you take him up on that, because I think he could really help you get you in the right direction, because there is a lot. I still it's kind of a rabbit hole going down the whole peptide thing for me, and one step at a time. But you got to remember,
so much.
You might have got sick only for a short period of time with COVID, but it's going to take a lot longer to get you back to where you need to be. So be patient and make sure you're doing your self-care, but your mind care. We were talking before we started this of mindset's a lot of it. It really is, of getting better. And I have interviewed people that are 100% now, and I love hearing that. We want the success stories. We want hope. I am jealous. I wish I was one of them saying it, and better's better. We just keep working, whittling away and being there. But great people like AJ are here for us, and we need to support them too, right? Because they're willing to do the research. So thanks again for coming on the show. Really appreciate it.
Thank you. It was fun. I appreciate it as well.
Tips? Anything you want to that's out there you might not said?
So last tips for long COVID. There's a few things that you can do today that can help out. Work on sleep hygiene. Sleeping too little or too much is a bad thing. Even though you may want to sleep longer, you cannot sleep that long. It will cause more problems. So sleep hygiene is really important. The hour leading up to bedtime, take away the screens. Don't be eating food 2 or 3 hours prior to going to bed. That helps support growth hormone as you're getting closer to bed. Get 7.5, 8 hours of sleep. Don't go over 8. Even if you feel like you need to stay in bed, do not go over 8 hours. Get up. Make yourself get up and get moving. A really healthy diet, low inflammatory foods, getting the right proteins in your diet is really important to help aid in recovery and muscle health and strength, and also to help reduce fat accumulation is getting the right proteins in your diet. So eating well, getting the right sleep, making yourself exercise. And I know this is super hard because I had the same problem when I was going through it. It's like, I don't want to exercise. I don't want to, but you got to start there and just kind of push yourself into it. And as we work through some of these other problems, these things will help create a better lifestyle to help overall recovery. And so just some simple tips with that: improved sleep and better eating and a little bit of exercise can go a long way. And it doesn't have to be like big time exercise. You don't have to go run 10 miles or do an Ironman, right? You can just get out and go for a walk, do a jumping jack, do some air squats, things like that. Things you can do at home, right? You don't need to go to the gym. You can do simple things, and just that movement and getting the heart rate pumping will really, really help out. And starting there, that's my tip. Just start somewhere, and then sleep, nutrition, and a teeny bit of exercise, and we'll make great headway.
Huge. Yeah. I have a mini tramp, and I pulled it back out because I thought, when I just don't have the energy, I'll jump on it and I sing 3 versions of this song, Every Little Cell in My Body's Happy. I don't know that one, but I sing that 3 times, and then I'm pretty much wore out and get down. But I just feel like it gets everything inside moving, and it's something. But even if you can just start out with just stretching, that's going to be better than nothing.
Oh, for sure. I agree.
No Ironmans for me.
Yeah. I got to take a break because my kids are too busy in doing their sports. And so I'm taking a break this year, but I usually try and do 1 or 2 a year.
Yeah. Yeah. That's not even on my wish list at all. I don't think it ever was. I'm not that extremist for that anyway. Well, okay. I hope everyone takes all those great nuggets and go off and enjoy your day or night, whatever you're listening to this now. And thank you again. Bye for now.
Yeah. Thank you.
Our biggest dream and desire is to bring lasting impact to the lives of the millions experiencing long COVID effects and symptoms all across the world. Please join us. You can reach out to us at adventurebucketwish.org.